So anyway, what were we talking about? I have flanges in my hand, so I think that's what we were discussing. I'm still holding the flange as from when we left off. Okay, so let's keep talking about flange sizing here. They're asking, how do you know what is the right flange size? And unfortunately, it's not like a bra. It's not like, okay, you get measured, show me your nipple, I'll show you what flange you are. It's not like that. You actually have to try it to be able to tell, because it's going to be very individual. You can't, doesn't mean, people think, oh, I have large breasts, I need large flanges. That is not true. That is not true. It's really sized to your nipple. It has to do with the elasticity of your skin. It has to do with your nipple size, most of all. And it could be different on each breast. And it will also be something that could change over time. So maybe you need one size in the beginning, and then a few months later, you're realizing that the flange is really not comfortable anymore. And it could be that you need a different size. So I always recommend a pump that has multiple size flanges that come with it. The Evenflo pump that, I helped to design, that I work closely with, and they have my education included with it. You know how much I love this pump and how much I recommend it. That pump actually has 3 sizes included, and that was one of the requirements. Like, we needed to do that because you need to have that to try out. If you don't have the Evenflo pump, you may have a different one that comes with multiple sizes. The best way to know and to answer the question directly is try them out and see which one is the most comfortable. Your nipple should not be rubbing. Okay, your nipple should not be rubbing against the sides of the flanges. If it's really, really tight and rubbing, then the flange is too small. If the flange is drawing too much of your areola in, then the flange size is too large, okay? It should be just right. And then it's just drawing the nipple in. There's room around the nipple, so it's freely moving in and out, and it's comfortable, and you'll see that your milk expression is going to be that much better. Does the Spectra have multiple sizes you can buy? I believe it comes with multiple sizes, maybe just 2. I'm not sure, but it definitely has additional sizes. Most of the pumps do. There are just a few that don't actually have another size at all, and beware of those, okay? I mean, with the Evenflo, there's 3 sizes that come with it, and then they sell 2 bigger sizes in addition to that. So if you get to the largest one that comes with the pump and you still need a bigger size, they sell it separately, okay? So hopefully that answers your question. I do have a really good video. That's one you could pull up. Joe's gonna post it for us in a minute, okay? It's a video that shows, I'm actually explaining flange sizing and what to look for. And I have a mom pumping on there, so you can actually see it. He's gonna post that right now for you guys in the chat. All right, so you can go back later. Don't leave us now, but go back later and you can click on it and watch it. All right, excellent. Oh, this was an interesting question. This question came in from Jen, and Jen said, are there any discernible differences between breastfeeding a baby boy versus a baby girl? And I had not seen this question come up yet, up until now. But it's an interesting question. And the way to answer that is, of course, every child is different, regardless of their gender, okay? But there are differences between boys and girls in the way that they grow. And what they've also looked at are some studies that they've done on monkeys to see that the milk is actually different, whether it was a boy monkey baby or a girl monkey baby, and the milk composition was actually different. There was more fat, more protein in the milk for the male infants, and that's in the animals that they were looking at. But that kind of lends itself to question whether there's a difference between genders in human babies, and they think there is, and there is a difference in the way they grow. Male babies tend to grow a little faster, especially in the beginning. Okay, so they may be eating a little bit more. The milk composition may be different. This is just so amazing because it all speaks to the fact that milk is made specific for your baby. Okay, and I've even seen the idea that we're giving the same with formula, we're giving the same thing from the beginning to every child. It's the same thing from beginning to end. Yes, it keeps them alive. Yes, it will help them to, when they can't have breast milk, but it's not the same thing. Breast milk is made specific for your baby, and when you're feeding and nursing your baby, you're giving breast milk that is made for that child, whether it's a boy or a girl. And on top of that, breast milk, genetically, the composition of your milk is matched to your baby. Think about it. It's coming from your body. So did your baby. Okay, both came from your body, and genetically there is a match. So this all is important, and so it's fantastic. I think that, yes, there is a difference between baby boys and baby girls. And for any of you guys out there who've had both, you might have noticed a little bit of a difference. But definitely in growth, they do see that baby boys will tend to grow a little faster, especially in the beginning. All right? Everybody kind of catches up around 1 year old anyway. They're all kind of the same at then. But in the beginning, you'll see some differences. What? No, nope. You can do that one too. Joe's asking me about the flanges. There's a video that we did on getting the right flange size. Okay, and then there was also a live stream we did a couple months ago, 2 months ago, on where I kind of lined up all the different flanges from all the different pumps, all different pumps on the market, and we looked at the differences between them. So that was kind of good too. He can post both of them that you can look at. Let's see, what kind of questions are you guys posting here? When I go like this, it's because I'm reading. Yeah, it's what does Jamie call it? When you're like looking at the phone, and he has a word for it. Speaking of Mr. Grayson, we will be seeing him. I'm leaving for Vegas with Joe on Monday for the ABC show. I'm super excited. I cannot wait to see all my favorite people and friends out there. And I'm going to be live streaming quite a bit next week. So, keep your notifications on so that you're getting notices from me. I'm going to be bringing you all with me. We'll be doing some live streams with Earth Mama. We got Back Buddy. Laura from Back Buddy will be hanging with her, and I'm sure doing a really awesome giveaway on the Back Buddy next week. We got Lola by Earth. We got all kinds of new people too that we'll be hanging out with and streaming from the show. So make sure that you have your notifications on and you're paying attention when I say go, so we can do those giveaways. And then you can just kind of see what goes on at this event. It's amazing. It's huge. It's like everyone's there. All the breastfeeding stuff, all the pumps, all the cloth diapers and the gear and all the new stuff on the market. It's fantastic. It's just for the industry, so it's all of us. But we get to be there as media, okay? So me and Jamie, we're all there, just kind of filming away, and get to bring you in with us to see what's new. So we'll be doing that next week. And then next Saturday night, after the show's over, after everybody goes home, Jamie and Joe and I will be staying in the same hotel, and we'll be doing our monthly Evenflo Feeding breastfeeding Q&A next Saturday night. Okay? From Las Vegas, live from Las Vegas next week. What, Joe?
We have a hard time with Mama at 9 a.m. on Tuesday.
Oh yeah, and our Earth Mama stream, we're going to be doing it right from their booth, okay? That's going to be on Tuesday morning, 12 Eastern, 12 noon Eastern, 9 Pacific on Tuesday morning, okay? And we have a really great prize, and we'll be meeting with Alicia and the whole team over at Earth Mama. So make sure Tuesday morning you're with me, okay? Oh my goodness, everybody's typing away here. I feel overwhelmed. All right, let's see. Let's answer a few more questions. Okay, that was done. Okay, Kimberly, I'm answering your question. You know why? Because you said, I've asked you this twice and never made it to the Q&A, but hope to tonight. So tonight you're getting your question answered, Kimberly. Hopefully you're here. I'd like to know more about weaning naturally, but also around 18 months. Okay, so she wants to know about weaning. Children will tip the natural age. Let's just talk about what is the natural age for weaning? The natural age for weaning is somewhere around 2 years to 7 years old, okay? That's natural. That is natural. That doesn't mean that you're necessarily going to do that or that you choose to. But that's the natural time when a child will, somewhere between that span is when they'll choose to actually wean themselves, okay? But if you're looking to wean naturally, but more of you're trying to encourage it, I guess, then the thing to do would be to start cutting out certain feedings during the day. And you're talking about around 18 months old. Just start cutting out those daytime feedings. You're going to be feeding complementary food. The child's eating solids at that point. Mostly they're being supplemented with breast milk in addition to all the food that they're eating. And you can start to cut out maybe one feeding during the day and, do things with them. They're distracted at that time anyway. They're into everything. And so that's a great time to start taking them off of the breast milk. The truth is that they need about 4 feedings a day at that time after they're about a year old, 4 feedings a day in addition to all the rest of their food. If you start cutting back on that and you're, switching that out with more foods, nutritious foods, even water you can give your child. You don't necessarily need to go to cow's milk, okay? And I'm not a huge fan of cow's milk, as many of you know, and your child doesn't really need to be switched to cow's milk. This was a question I think that came up recently where someone was saying, their doctor was like, you need to start giving the baby cow's milk. That is absolutely not true. So no cow's milk is necessary at all. But yeah, naturally weaning would be to allow the child to, on their own, just stop certain feedings. And the easiest ones are going to be during the day and then starting to move towards the night and early morning, okay? Especially for you too. The thing for you to remember is to actually do it slowly so you don't end up engorged. I need to take a sip. I just talked for a really long time and now my throat is really... There you go. Okay. Make sure that you're doing it slowly so that you don't get too full, you don't end up with mastitis, plug ducts, all those other things, okay? So Kimberly, I hope that answered your question that you keep on asking. I'm not sure if it did or not, but you can ask again if there's something I missed there. Okay. Should we do a question online here or should we do another one from that people asked? Let's answer your questions. Let's see. All right, so what did you guys say here? Any advice for restarting nursing once baby has been on formula? Asking for my sister, baby is 2 weeks old. Okay, that's from Ruth. Ruth, absolutely. The baby's only 2 weeks old. The most important thing right now is to keep on stimulating the breast. I don't know, answer this question for me. Has she been pumping? Is she maintained her supply? There's 2 things that happen when you start introducing formula too soon, or exclusively formula, and then you're not feeding at the breast. You now have 2 issues. One is the baby may have difficulty latching back to the breast, and 2, if they do go back to the breast, the milk supply may have already started to disappear or decrease. So we need to make sure that her supply is good and that the baby is latching well. If she wants to go back to if you want to go back to breastfeeding, then it is very important that she starts working with a lactation consultant as soon as possible because she's going to need some help to be able to latch the baby. And I think she just said pumping and dumping because she had autoimmune issues. Okay. When you say autoimmune issues, do you mean she's on medication that someone told her she can't breastfeed with? Is there some... I'm not really sure if she's gotten the right advice, to be honest with you. Autoimmune issues. There are not that many medical conditions or even medications that moms have to stop breastfeeding with, okay? There really aren't that many. So whatever this autoimmune issue is may not even be a real issue for breastfeeding. And it could be just something that someone told her, someone didn't have the right knowledge, her doctor, someone that is giving her bad advice. So I just want to know what autoimmune issue she has. But it's very rare that you cannot breastfeed. In certain cases with HIV, possibly, and I say possibly because depending on where somebody is in the world, they're still recommending breastfeeding because it's so important. Hepatitis, you can still breastfeed. So there's a lot of people who have all kinds of issues and they can still breastfeed. And I'm assuming it has nothing here to do with her milk supply because if she's pumping and dumping it, she's still producing. So I'm really not sure what the issue is. And I don't know if I can answer it until you respond there. She said, let's see, she had a staph infection and was on medication. Okay, thanks, Lara. Yeah, so sounds like she had antibiotics. If she had a staph infection, she was on antibiotics. Most antibiotics are totally safe to breastfeed with. So, sometimes people will be told to stop breastfeeding because they're on a certain drug, and it's not accurate. Or they're taking a medication that they could not be okay for breastfeeding, but there's an alternative that is. So that's the first step, Ruth, is to find out what the actual answer really is. Is there really an issue? Is this medication unsafe? If it is unsafe, then what's an alternative that would work? A great place to go for all of you guys who are taking any kind of medications and wondering, is it safe to continue breastfeeding on this med, is it's a website called infantrisk.com. Infantrisk.com. Joe's going to post it for you guys. It's great, and they have a hotline, and you can actually call them up, and they're so helpful. You could tell them the drug that you're on, and they can give you the recommendation and like the safety of it for breastfeeding. So it's really different when you're breastfeeding than when you're pregnant. Okay, remember that for many medications, they're not safe to take while you're pregnant because you're talking about a developing fetus. You're talking about a blood connection. You're talking about a continuous connection through the umbilical cord. Whereas with breast milk, it's quite different. You're talking about intermittent feedings, time going by in between. It's not blood to blood. And so the amount in the milk might only be about 1% of what you're actually taking, which may have no effect at all and can be perfectly fine for an infant. So don't let anybody tell you that a medication is unsafe to take and that you have to stop breastfeeding or that you need to pump and dump your milk until you check it out for yourself, because most docs are not that knowledgeable about this. And if you think about it, there's not really that many studies that are done on nursing moms. It's not like they just line up, 20 nursing moms and give you all a drug to see just what happens to your baby. So we just don't do those studies, but you have to look at what is the infant dose that they're getting. Remember, this is not a developing fetus anymore. This is a full-term, healthy, full-grown baby, and this medication is going in there into the milk, but in small quantities that they're ingesting. Some drugs that you even take don't even get absorbed through the gastrointestinal system, so you might have gotten something through an IV or anesthesia, whatever it is, and it's not even. If they drink it, it doesn't even go into their bloodstream. These are all things that need to be taken into account, as well as complicated things like half-lives and all these other things that cause the milk to accumulate at a certain time, and then it starts to diffuse out of the milk, so the milk is safe by the time you go to feed the baby again. All right, just too much to actually go through each specific, but the website right there, Infant Risk, that was the best advice I just said with a lot of words around it. So, okay. All right. Oh, now she's saying steroids and Kineret, which is an injection like Humira, and a strong antibiotic for a staph infection. Okay. Yeah. What you want to do is, this is probably a temporary situation, but in the meantime, I would still go to infantrisk.com and check out those meds and see which ones and what the advice is, because it may be just timing issues. Okay? All right. Let's see. Any other good questions here?
Question from Liz.
Yeah. Where's that? Oh, Joe's handing me the phone. Okay. A question from Liz. Liz says, we exclusively pump 8 months now, but have noticed a big dip lately. What can I do to up my supply? Oh, that is a good question. Thank you, Joe. Okay, Liz. So pumping is hard. Okay, so first of all, congratulations and kudos to you, because I know how hard that is to exclusively pump for your baby, and it is. I just have so much respect for that, and I want to help you. So yeah, it could be that your baby's just needing less right now. I'm not sure if your baby's eating more food, but typically if the baby starts to eat more, starts to need less, that's what happens if you were nursing at the breast, okay? But yes, weaning. Okay, so if the baby's starting to eat more foods and you're not pumping at the same pace as what you were doing before, you're naturally matching the baby right now, okay? And that's going to start to decrease your supply. If you want to increase your supply, which I'm not sure by what you're answering here, whether you actually want to or not, but if you want to increase your supply, then obviously the answer is to just keep pumping more. Trying to pump more, stimulation to the breast is the best way to increase your supply. And also make sure that you're staying hydrated. And again, we talked about this last time. Drinking to thirst. This is a huge misconception that you need to drink and guzzle tons and tons of fluid in order to make a lot of milk. That's not true, and it can actually have the opposite effect, okay? So if you're drinking to thirst, then you're just staying hydrated. Enough water to keep you not thirsty and to keep your urine a pale yellow, okay? That is how much water you need. More than that can actually have the opposite effect and decrease your supply. Liz says, I do. We have to supplement 1 formula bottle a day. Okay, so did you get your, if you're getting your period again, that could also increase your supply, decrease your supply. So starting to get your period, and that can happen, either it can happen pretty early. It usually can happen after the baby's around 6 months old. If the baby's sleeping through the night, if you're not pumping at night anymore, those are all reasons that your supply might start to decrease. It could also be, and I'm going to say this to you, it could also be that a misperception, is that a word? Misperception of how much your baby actually needs to be eating. So I always say that if you're doing just 1 formula bottle a day, you probably don't need any, okay? If it's only 1 time a day that you're supplementing, you probably don't need any more. I would say that if you were to really understand that your baby might be needing a lot less, after 6 months old, your supply naturally goes down. How many of you guys have noticed after 6 months that your breasts feel smaller? Like all of a sudden your bras don't fit anymore. Your breasts kind of shrunk back to what they were. They just don't feel as full anymore. That's all normal. Okay, that's natural, that's normal. Your baby's starting to eat solid foods. The baby's possibly starting to sleep longer stretches, maybe at night. Maybe you're not waking up at night as much. Maybe your period is back. All those things can typically decrease your supply. I would, instead of the 1 bottle of formula, if you really feel like the baby's still hungry, even after the feedings, after how much you're pumping, I would increase the solid food before I would give more formula. I don't really think that that's necessary, 1 bottle. The other thing too is, earlier we were talking about flanges. You're an exclusively pumping mom. You've been using your pump around the clock, I'm assuming, for many, many months now. It could be that it is not you, but it was your pump. If your pump is not functioning up to par, if your flanges are not fitting anymore, as we talked about before, it could be that you need a new size. Your breasts may have changed shape and your nipples may have, may need a different size flange. If all those things are not happening, or your pump is not functioning, or your valves need to be replaced, your membranes, all those little parts, that could impact how much you're actually getting out with your pump, which will then have the secondary effect of decreasing your milk. So that's my advice to you, is to really pay attention to why is it that you're not pumping as much. Are you utilizing your pump the right way? Are you able to stimulate multiple letdowns during your feeding? And which pump are you using? Because that will impact it. But that's what I would say. Let's see here. Any other questions? There was a question that somebody asked me. Oh, let me see. This was from last time we talked. This was from Katrina. And Katrina asked, can you successfully breastfeed a tongue or lip-tied baby without it killing your nipples? Okay, so for many of you guys, you've heard of lip ties, tongue ties. That's when the that tissue underneath the tongue can be very, very tight and cause the baby to have a tongue that won't extend beyond their gums. When that happens, it can make for a really difficult latch. It could make for an impossible latch. It could be very uncomfortable. It could cause you a lot of pain. It could make it very difficult for the baby to latch onto the breast. And so that's a tongue tie. A lip tie is when that little tissue between the gums and the lip is very tight, which again can really impact the baby latching to the breast and getting a good latch. They continue to come off. They're not able to. Some babies don't gain weight well. It can impact your supply. So she's asking if you have that tongue tie or lip tie, will it always cause pain? First of all, if it's causing you pain, or if the baby's not eating well and the baby's actually not gaining and not maintaining the milk supply because of it, that needs to be handled. You need to talk to your pediatrician. You need to have someone take care of. It's a very simple procedure where they can clip the frenulum, that little piece of tissue there, to release the tongue. It can have long-lasting impact on the child and their speech and other things. So you want to make sure that that happens. But if you don't have a very bad tongue tie and the baby's gaining weight and you're not in any pain, so if, like she's asking, does it have to kill your nipples? Not necessarily. I know many people who have, we happen to see it just because I look in the mouth and I'm like, oh, there's a little bit of a tongue tie. Still not causing any problems. There's nothing that needs to be done about it. So unless it's really bad, and usually you'll know that if it is, because the baby will be struggling with the latch. But no, it doesn't have to be killing your nipples. A very good friend of mine her baby has a pretty severe lip tie and has been nursing great, and the baby's like, I don't know, 8 months old, and she didn't even know it was there until the doctor pointed out, and they're going to correct it, but it hasn't caused her any pain at all. So yeah, you can have pain or you might not have pain. That's the answer to that one. There you go. Tasha's asking, how do you get multiple letdowns? Oh, that is a good question, Tasha. I'm not going to go over it specifically tonight, but there is a video that I'm going to refer you to. Joe's going to find it for us. He just closed his computer and now he's going to open it again. There was a live stream I did, when was it? A couple weeks ago, because I talk about multiple letdowns all the time, about how to adjust your speed and suction control so that your letdowns are multiple and robust, and so there's tons of milk flowing, and when you see that milk starting to trickle out, you're pumping and you're getting those drops and you're not really seeing the full amount coming out anymore, how to stimulate it to start it again and start it again so that you really empty your breast. Joe's going to post the link, the link for that live stream that we did on how to stimulate multiple letdowns. After that show that I did, and I just went over that, I had a whole bunch of people messaging me saying they got more milk than they ever did after that one live stream where I showed you how to use your pump. Like, nobody ever shows you how to use the pump the right way. It's crazy. You have this machine, you're hooking it up to your body. It's so important. You're trying to get milk for your baby, and then nobody ever teaches you how to use it properly. Okay. So, yeah, that's a really good one to watch so that you can, should I just do it right now? Do you guys want to know how to get multiple letdowns?
How about they give you some love while I take a drink?
Joe wants me to take a sip. How about some love while I take a sip of my water here, he said. How about some love? And then I will show you how to stimulate multiple letdowns. Letdowns. That's what I said. Letdowns. Multiple letdowns.
Still post the video?
Post the video anyway, and I will still show you. Okay, yes. They're all saying yes. Okay, let's do it. All right, I'm going to show you how to do this. Okay, so let's use the pump as a demonstration here. You guys are so fun. All right, so this is how you do it. So here's your pump, okay? Your regular little typical pump. This is the Evenflo pump here. Okay, and so see how there are, yeah, here comes the love, okay? Here goes the delay. It's the delay. I say, can I have some love? And then nobody responds, and then I got to say, oh, it's a delay. They're going to come. Okay, and what you do is this, okay? You've got the speed here, and then you've got the suction here, okay? So what you need is a pump that has individual speed and suction controls on it. One that controls the speed, one that controls the suction. The way that you use the pump is initially, and you might want to write this down, okay? Initially, you're going to start your pump with your speed turned all the way up and your suction nice and low, okay? So there's going to be quick, gentle suction, quick, gentle suction. That's that letdown initial stimulation phase, okay? And you're going to keep the pump on, make sure your flanges fit right, make sure your nipples, centered in the hole properly, and then turn on your pump with your speed all the way up and your suction turn low until you see milk starting to drip. As the milk starts to drip and you start to see milk starting to come out of the breast, that's not because you're sucking it out, okay? That's because you're stimulating the nipple, which is sending a message to your brain, which is telling your brain to release oxytocin, which is the hormone that causes the milk, the little muscles around the milk ducts to contract and push the milk out. That causes the letdown, okay? That's how it works, okay? You're not pulling the milk out of your breast. You're going to cause that stimulation. Your milk starts to flow a little bit. As soon as that happens, what you're going to do is immediately turn your speed down, maybe to halfway, and turn your suction up, not all the way up, but to a spot where it still feels comfortable, that you can still, there should be no pain, okay? So no pain. You don't need to turn it all the way up. And in fact, when you turn it all the way up too hard, it could actually stop the milk from flowing because you need to be comfortable while you're pumping. So the next step is to turn your suction down and turn your speed down and turn your suction up to where it's comfortable. Then you're going to see the milk flowing, okay? The milk starts flowing, the milk starts flowing, the milk's flowing, and that goes on for a little bit, and then all of a sudden it starts to stop. All right, it starts to dwindle down, and you're just seeing drops again, and you're really not seeing anything. And then you're like, why is it not emptying my breast? This can't be it. I still feel full. Okay, because that's the point where you need to stimulate the second letdown. Okay, now the second letdown is not the same as the first letdown. The second letdown, you're not going to go back to where you started. You're not going back up to the high speed and the low suction. You're going to leave your suction wherever you had it. Okay, wherever you had it, keep it where it was, and then take your speed and increase your speed all the way back up while you keep your suction the same. So you're going to just do the same amount of intensity, but just faster, okay? Until you start to see the milk dripping again, okay? You got another letdown, then turn your speed back down, all right? And you're going to repeat this for as long as you can to keep getting milk out. So after that initial time, you're going to leave your suction where it is, and you're never touching your suction for the rest of the time you're pumping, and you're just moving your speed up and down to keep stimulating multiple letdowns. And that, everyone, is how you stimulate multiple letdowns. And now I can get all nice messages from each and every one of you who try it and get more milk out, because I love to hear. I mean, the best thing I can get is messages from you guys, all right? Telling me how what I told you worked, or how you used what I said and it worked out great for you. I want to hear it. So yeah, now I expect a whole bunch of you to show me pictures of your pumped milk tonight, as you usually do, saying, look how much I got with my multiple letdowns. Yay. Okay. All right. Hearts for that. All right. We went over it. And then there's also a link from the last time I did it where you can all see me saying exactly the same thing again. You guys are so fun. All right.
Give them a chance to ask a personal question.
A personal question from me?
You wait and be patient. You pick one.
Okay. So Joe's saying if you want to ask me, if you want to ask me a personal question about me or about them. Joe's saying if you want to ask me any personal questions right now, you can ask me personal questions. I may not answer all your personal questions, but I may answer some of it. Yeah. So go ahead. Let's do something new. Ask me personal. You could ask me whatever you want. You know what? I'm as you can tell, I'm extremely shy. So I'll answer anything you want. I will answer anything you want. Elena's asking, when should I pump after baby nurses? About an hour after the feeding is a good time to pump if you're trying to store up a little bit of extra milk in addition to what your baby's nursing. So if you're nursing and you're like, okay, when do I actually pump? If she's always nursing, about an hour after, and that's going to start to increase your supply a little bit, just enough to get that extra milk. It will also be fine for the next feeding too. The breast is never empty. You know, it's not like it fills up, you drain it empty, and then it's completely empty till the next feeding. It's not like that. It's constantly making milk. And what happens is over time, it starts to feel full because it's always making milk. So you can always get some milk out. And actually, right after you pump, for those of you guys who are exclusively pumping, or if you're going to be pumping at work, it's good to try to express a little bit of extra milk. Do some hand expression just to get that last bit out, because you can usually do that with your hand much better than with the pump. Hello, Miss Tara. Thank you. I miss you. Tara, my friend Tara just jumped on. Tara was in my live classes many, many moons ago. And we are good friends from here in New Jersey. So she's here. Hi, sweetheart. I miss you. Okay. So let's see. What are you laughing about? Joe's laughing
at asking who's new, who's watching you for the first time tonight.
Oh, Joe wants to know who's new and who's here for the first time tonight. And okay, Abaddon, is that how you say Abaddon? Abaddon. Dawn. Okay, can I call you Dawn? Is asking me how many children do I have. I have 2 girls. They are Jade and Talia. Jade is 14 and a half and Talia is 12 and a half. And they are getting so big. It's crazy. Here's a picture of them when they were little. I'll show you a picture. So I can show you right now. See, there's them right there on the mantle. And then I have little Lucky too. There's Lucky in his bed. I bought him a new bed. My dog has like a bed and bag fetish, okay? He likes beds and he likes Lucky. There he is. Say hi. There's Lucky. He was like, oh my God, you just shocked me. My dog loves bags. And Lucky's my little baby. He's 4.5 pounds and he gives me that, like when you want to just like hold and cuddle a baby, I love that so much. Not enough to have another baby, but I do that with my dog. And so, yeah, he fulfills that little bit of need in me there to hold a little one. My other little ones are not so little anymore, and they're adorable, but they're not little. Your daughter's middle name is Jade. Yeah, you love Lucky. I love Lucky too. Yeah, Jade Renee and Talia Rose. That's my daughters. And they're both exclusively breastfed. And I learned so much after having them. I don't know how many of you guys are new and don't know my background, but I'll give you a little bit of an insight here, why I'm even doing this here. This is not how I've always taken care of moms. I've been doing this for like 25 years. I've been taking care of moms as a registered nurse. I was in labor and delivery for many, many years as a registered nurse. That's how I started. And then I was a nurse midwife. I had my own practice for almost 10 years. I delivered over 600 babies in my practice. And I wasn't really into breastfeeding. That wasn't what I was working and doing. I was dealing with birth and labor and even, regular well visits. I had women coming to me for their regular PAPs and everything else. And then it wasn't until after I had Jade, my first, that I struggled so much with breastfeeding. It was so hard. And I really couldn't believe that I didn't have the knowledge. And there I was working with women for all those years and delivering babies, and I didn't know what I was doing. And I thought, my God, if I don't know this, then nobody knows this. I mean, we just didn't learn it. And so it really changed my whole perspective on breastfeeding. And I decided to become a board certified lactation consultant. I opened a store. I started teaching classes. And then I just got so completely involved in what comes next. So, that was what comes next when the baby's born. What do you do bringing a baby home? What products do you need? How do you pump? How do you go back to work? How do you juggle the whole thing? And I got so passionate about helping everybody with that. So that's what I do now. And I had my store, my learning center for like 12 years. And that's actually where I started doing the live streams. Back in 2010, we started doing these live talks, and the web TV show every week was called My Baby Experts. And that's how I met Jamie. Jamie used to come in from the city and sleep on my couch and do the live show with me. And when you see when you see me posting videos on my Facebook wall of all the clips, because there are so many episodes and they're great. I know they're a few years old, but they're so great. There's a whole index. You want to post the index? Because some of you guys don't know, there's like 600 videos on all different topics. I had the best guests for this show. If you want to watch some of my stuff, you could sit there for days sitting there watching it. Joe's going to post the index that comes to that takes you to my website, and it actually has a whole index of all the different clips from the show, and some of them are me and Jamie, and some of them are me with people like Dr. Green. Did a great interview with him on feeding your baby and all that, first foods, and Dr. Susan. We did so many episodes with Dr. Susan, awesome pediatrician that I love so much. So, how did my IBCLC exam go? It came and went. I studied a lot, and I recertified after 10 years. We don't get results for a couple months. It sucks. Wait a couple months to get my results, but I think I did well. I studied a lot, and I have a lot of new. Joe said I crushed it. Let's hope so. Oh God, let's hope so.
So we have some newbies tonight.
We do.
Some love.
Yay, yeah. New people. We love new people. Rachel's new. Valerie. He's giving me awesome. How long did I breastfeed my girls? I breastfed each of them for 13 months. Look, and I just said this to Joe. What is it, like yesterday? Just yesterday. I swear to God, we were in the car, and I said, I wish. And again, I didn't know as much as I know now. Okay, that was Jade's 14 and a half. Talia's 12 and a half. If I had known then what I know now, I definitely would have nursed them longer. I wish I had nursed Talia longer. She would have nursed for way longer. She never took a bottle. She never took a pacifier. She was just exclusively breastfed. I had her at my store with me, just wearing her in a sling and nursing her. And, I think I was impatient, and I wasn't thinking like, this is it. And I rushed the whole process at 13 months, and I weaned them. But I feel really good about it. I mean, this was something that I look back now and I think, wow, I did a full year of exclusive breastfeeding. Even though I was working with Jade, I was working as a midwife, and I was running back and forth to the hospital in the middle of the night, and still I made it work. I pumped. Joe would drive her to the emergency room parking lot, and I would run down and nurse her in the car. But we were really committed to it for that first year. And I think that was part of the reason why I was a little bit in a hurry to stop. But looking back now, I would have done it longer, especially if I had known that she would be my last. I wasn't sure at that point that she would be. But yeah, she was my last. It is, this month is infant loss and pregnancy loss awareness month, I believe, right? So, it's reminding me of that. I had lost twins a couple years ago, and so that was kind of sad. And I think now that, we would have had 6-year-olds at this point, right? They would have been about 5, 6 years old, just starting kindergarten. And I know there's so many of you out there who have had a loss yourself. And, I've been there too. I never thought that she would be my last. I always thought we'd have more children, but we don't. And so, it's really sad when you think about it, but I do feel good about the children that I have, and that I was able to give them everything that I could while I did. And now I get to help each and every one of you. So that's the best part, is that I get to take this knowledge now, and even though can't actually do it for my own children, I do it for you. So that feels really good. Yeah, thank you. Yeah, I know. And I know so many of you guys have dealt with the same thing. And there's actually a whole episode. That's actually something good. I think I'm going to repost that episode, because it was a really good episode that we did several years ago on infant loss and miscarriage. And it's like a topic that's just not talked about enough, even though so many of us go through that. And I think we'll repost that at some point and on my wall this month and honor that episode because it was really, really good. And I know some of you will. 12 years ago I lost one of my boys. Tasha's saying, I'm so sorry. We all share so much of this in common. So much of this. Yeah.
Melinda's got resources.
Oh, and Melinda too from Earth Mama. She's got a great a whole section on infant loss on her website and some products for anybody who you know that may have experienced that, and a lot of great resources. I forgot what it's called. Healing Hearts on Earth Mama Angel Baby.
The web address is, I'll post it, but it's
Joe's going to post it.
babylostcomfort.com.
Oh yeah, babylostcomfort.com. That's a great resource from Earth Mama. Joe will post the link for you guys. My mom, Monica says, my mom miscarried so many times. She miscarried twins last. I was 11 and very aware of it. She has 6 children though, and my youngest brother is the light of our lives. Yeah. I mean, it's something that it's so common. It's just so common. And so my sister lost a baby. My mother lost my sister was actually a twin. My mom lost my sister's a year younger than me, and my mom had twins and 2 girls, and they were, back then they just couldn't save, preterm babies, and they were not even that young. I think they were like 28 weeks, maybe 30 weeks, and one of them just didn't survive, died at 2 days old. So my other sister. So we've experienced a lot of that in my family, but when I work with so many women, and I get to see like just how common it is. So I don't know how we got on this topic. I guess Joe asked about personal questions, and I decided let's share some personal stories here. I'm here with you guys, and so just thinking about it. There we go. Anything else that we should talk about tonight before we call it a night? I think that I'm going to say goodnight to all of you guys. I hope you guys all liked or loved this post, and I know you all commented because I read all these amazing comments from each and every one of you. Check out my video index, and also check out my classes if you are interested in taking any of the classes. I've got the Simply Breastfeeding. If you're pregnant right now and you're like, what do I do? How do I get ready for breastfeeding? What's the best thing I could do? There's nothing better than going and watching that Simply Breastfeeding class so that you're prepared for the delivery. You'll just have that knowledge and the confidence to go into it with knowing what to do. And in many cases, you'll know more than the people around you. So Simply Breastfeeding, and if you're already pumping, or you're going back to work soon, or you're thinking about like, what do I do next? I want to be able to give the baby a bottle and also breastfeed. Breast pumps and briefcases, my other class, is fantastic for that. It will help you. Don't watch it the week you're going back to work. Like, start earlier so that you have time to build up. It'll give you, calculations of how much do you need to store and how much do I need for that first day back, all of that. Watch that class. And then there's also the cloth diapering class. So that's an awesome one for many of you. I know Chelsea's watched that one. So it's a great class. You'll love that one too. And have a wonderful weekend. And please, please, please make sure you're getting notifications for next week in Las Vegas, okay? Because I'll be coming to you live a whole bunch, okay? It was amazing to see each one of you tonight. Who had a good time? Who learned something tonight? Did you guys learn something new? Do you learn something new each time we do this, I hope? Yes, can we have some hearts? Good night hearts, good night kisses. Yes, great feed. Okay, awesome. I'm so glad. All right, well, I love you guys, and I will see you very, very soon. And I'll be announcing the winner of the Earth Mama Angel Baby Milk to Go by tomorrow. Okay, so just post here, and then I'll be announcing it. Good night, everyone. Love you all. Mwah. See you soon. Bye.